Medical practitioners are naturally the most trusted professionals out there. They investigate and treat cases from common ailments to life-threatening afflictions. People openly place their welfare in the hands of a stranger. However, what happens when that trust is broken? A suspicious blaze, a passionate affair, mystery and murder all tangled within a harrowing web, woven by a malicious Englishman. Tonight on Dark Curiosities, the crimes of Dr. Pritchard, the human crocodile. Edward William Pritchard was born into a naval family in Southsea, Hampshire, England in 1825. Around 1840, when Edward was 15, he became a surgeon's apprentice and, according to claims made by Pritchard, he graduated from King's College Hospital in London in 1846. Following his graduation, he joined the Navy and served as a surgeon's assistant on the famous HMS Victory, and he continued to serve on various other ships for the next 4 years. In 1850, whilst on leave in Portsmouth, Edward met Mary Jane Taylor, the daughter of a wealthy retired silk merchant from Edinburgh. Mary Jane had been staying with her uncle, Dr. David Cowan, who was a retired naval surgeon. Pritchard charmed her family, and the pair were married in 1851. Together they had 5 children, 3 daughters and 2 sons. Edward suddenly resigned from the Navy and took on the role of a general practitioner in Yorkshire. However, by 1859 he was drowning in debt, and there had been accusations of inappropriate behaviour towards his female patients, and so during this storm he decided to relocate his family to Glasgow, Scotland. The legitimacy of his medical qualifications were brought into question by many, and it was actually discovered that Dr. Pritchard had bought his diploma from a German university. The Pritchards first moved north to Edinburgh, temporarily living with Mary Jane's parents until their home in Glasgow was ready. Edward was a colourful character with many a fanciful tale to tell. For example, he was reported to have said he was friends with General Garibaldi, and his brother was the Governor-General of Ceylon. Another story he told was one of where he plucked eaglets from their eyries in the deserts of Arabia and hunted the Nubian lion on the prairies of North America. Despite his endeavours, he failed to be accepted into Glasgow's elite medical societies, and also his efforts backfired whilst attempting to integrate in superior social circles. Oddly, he would hand out postcards with a picture of himself on it to people of whom he thought were worthy. Despite Edward's financial problems, the Pritchards secured various properties in Sauchiehall Street, which was, during this time, one of the finest areas to live in the city. They owned a property at number 11 Berkeley Terrace, the attic of which became the residing place of servant Elizabeth McGrain, aged 25. On the 6th of May 1863, a policeman patrolling the area witnessed flames coming from the attic at approximately 3 a.m. and battered the door to raise the alarm. Dr. Pritchard yelled for Elizabeth, but to no avail. The inferno had originated in her bedroom, however she had made no attempt to escape. The young woman may have been unconscious, drugged, or possibly deceased already. Rumours rippled through the city, whispers of an affair between McGrain and Pritchard, and, intriguingly, talk of a possible secret pregnancy. Authorities were suspicious that the fire had originated whilst Mary Jane and another servant were away. However, they concluded that the blaze had been an accident, a gaslight the cause, whilst Elizabeth read in bed. The family once again moved to a new place of residence at 22 Royal Crescent, where Edward hired a 15-year-old servant, Mary MacLeod, from Islay. He found himself deeply attracted to her, and whilst his wife and children were enjoying summer in Dunoon, he seduced Mary, despite the fact that he himself wasn't exactly the epitome of a handsome Victorian gentleman. The Pritchards once again jumped ship to a £2,000 property at 131 Sauchiehall Street, now number 249. He couldn't actually afford to move, but Mary Jane's mother contributed £500, whereas the rest was on loan along with an overdraft. In the late months of 1864, Dr. Pritchard was caught by his wife kissing the young Mary MacLeod. It was around this time the young islander became pregnant. She was afraid of her fate, yet Edward reassured her that if Mary Jane perished before him, he promised to marry her on the condition that Mary had an abortion arranged by him. Not long afterwards, Mary Jane Pritchard was struck by sickness. Edward diagnosed his wife as suffering from gastric fever, and during the festive season, she recovered from her plight. Records show evidence of Dr. Pritchard purchasing deadly poisons in large quantities, such as tartarized antimony and tincture of aconite. In the new year, Mary Jane fell ill once again. Her cousin, who was a doctor, diagnosed a stomach irritation and prescribed a mustard poultice along with champagne and ice. Her condition only worsened until the point she insisted on seeing another doctor, who turned out to be one of her brother's old university classmates, and he was professor of medicine at Glasgow University. His diagnosis was of drunkenness and hysteria. She was prescribed with bread, milk, and boiled eggs. Anxious about her daughter's condition, Mary Jane's mother, Jane Taylor, moved in to help. Jane began to show symptoms of a serious health issue and took pain relief. Jane depended on Batley's sedative solution, in other words, opium. She managed to take a full 3 months' worth of medicine in just 2 weeks. Both women's conditions further declined. Dr. James Patterson came to their aid and, after an extensive investigation, concluded that Jane was under the influence of opium. James, of course, was entirely unaware of Dr. Pritchard's dark deeds. On the same day, 25th of February, Jane Taylor passed away. Edward Pritchard signed her death certificate, citing the cause of death as being paralysis and apoplexy. He also had the nerve to appear at her funeral in Edinburgh. Dr. Patterson continued to treat a hallucinating Mary Jane, who was, unfortunately, still declining. She died aged 38. Sources vary the exact date, somewhere between the 17th and 19th of March. Once again, her husband signing the death certificate and stating that she had passed due to gastric fever. Mary Jane was to be buried with her mother. However, before the burial could commence, an anonymous letter was received by the Procurator Fiscal urging an investigation into the suspicious deaths of the 2 women. Edward Pritchard was subsequently arrested, yet Mary Jane's family refused to believe he would be capable of such evil acts. Jane and her daughter's bodies were exhumed, and after a thorough investigation, tests concluded that antimony was found in their remains. The reactions of the public and of the media were of utter horror and disbelief. One newspaper reported of the trial, "No one who saw the intelligent, thoughtful and mild-looking individual seated in the dock on the first morning could be prepared for anything like the consummate villainy and diabolic cruelty which each day brought to light. The whole murderous plot." He was put on trial in Edinburgh in July 1865. Dr. Pritchard forced his young children to testify how wonderful a father he was and just how devoted he was to their mother. During this segment of the trial, Dr. Pritchard was seen with tears rolling down his face. During Mary Jane's funeral, Edward wished to see his wife one last time. Removing the lid of the coffin, he wept inconsolably and kissed her, many accusing him of crocodile tears, earning him the nickname the human crocodile. Evidence of his affair with Mary MacLeod was presented to the court, as well as proof of the poison used, and among gasps of horror, Dr. Pritchard's reputation was destroyed before him. It took the jury a mere hour to find him guilty, and Lord Ingalls passed the sentence. Following his murder convictions, Dr. Edward Pritchard was to be hanged. With 21 days left of life, the condemned doctor turned to religion and finally confessed to his crimes in prison. He said, "The sentence is just. I am guilty of the deaths of my mother-in-law and wife. I can assign no motive beyond terrible madness. I alone, not Mary MacLeod, poisoned my wife. Dr. Pritchard set his sights on the gallows at Jail Square, situated behind Glasgow Green near Salt Market on the 28th of July 1865, due to be hanged at 8 a.m. William Calcraft was the executioner and had 45 years' worth of experience behind him. The crowd of over 100,000 hissed and cheered as Pritchard made his way towards the hangman's noose. By the scaffold he made a final prayer, rope wrapped around his neck, cap over his face. Edward William Pritchard was hanged at 10 minutes past the 8th hour. He was buried at the infamous Murderers' Graveyard, located near South Prison, where the graves are only acknowledged by a small stone bearing initials only. The execution of Edward Pritchard was the last public execution carried out in Scotland. Dr. Pritchard was calculating and deceitful, concealing the truth about the circumstances surrounding Jane, Mary Jane, and Elizabeth's deaths, not forgetting the ordeal of young Mary MacLeod, an infamous monster among men. His villainy is notorious in Scottish criminal history. The women who suffered at his hands must never be forgotten. They were someone's daughter, sister, mother, friend. It is a cruel irony that a man of such a profession was the one who actually took the lives and innocence of these women, who would have trusted him, as all doctors should be.